Good morning. Thank you for joining us at the Ohio State East Hospital for this announcement of our Right to Recover initiative here in Columbus. We chose Ohio State East as one of the frontline testing locations that is doing the work to help keep our community safe. I want to thank them for that work and for hosting us this morning. The COVID-19 pandemic and its resulting economic crisis continue to impact workers and families in our community and across the country. Like many economic shocks, this crisis has disproportionately impacted low-income workers who can least afford disruptions in their lives. But unlike past downturns, the physical health and economic security of families are linked more directly and more inseparably than ever. In a COVID-19 pandemic, too many residents face the double jeopardies of low-wage jobs that require in-person work. On the one hand, showing up in person exposes them and their families to increased risk of infection during the pandemic. But not showing up at all means they can no longer afford to meet a rent payment, a doctor's bill, or the costs of their child's medicine. It is in our citywide interest for every resident to have access to testing without fear of what will happen to their paychecks if they test positive. But until now, workers unable to access sick pay, for example, have had no recourse to provide for themselves or their families if they are required to isolate following a positive test. A pressing barrier as we try to promote testing across every zip code of Columbus. For low-wage earners, a positive COVID-19 test doesn't just foretell a serious health concern, but also possible financial ruin. According to a July study on the impact of COVID-19 in major U.S. cities, more than half of residents report experiencing serious financial problems, especially Black and Latinx individuals. This study was conducted just as federal employment dollars were winding down, so the financial strain on families now, especially low-income families, has only increased. Additionally, the infection rate right here in our city of Columbus has consistently been around 4 times higher for Latinx residents and twice as high for Black residents when compared to white residents. It is easy to see the connection between the higher rates of infection and the jobs disproportionately held by people of color, jobs that largely require in-person work and are least likely to offer paid time off. All of this together is what creates that impossible decision for workers between protecting their health and protecting their income if they contract COVID-19. In response to this reality that far too many of our residents are facing, we are introducing the Right to Recover initiative in partnership with Columbus Urban League and Catholic Social Services. These partners have important, established relationships in the community that will ensure eligible workers can participate in the program. Right to Recover will offer residents the financial resources they need to take time off of work, isolate, and recover following a positive COVID-19 test. The program provides approximately 2 weeks of income replacement, up to $15 per hour based on a current pay stub. The program taps into $1.21 million of federal CARES Act funding. Eligible residents must earn at or below 150% of the federal poverty line and have tested positive. All of this will happen before December 31st, which is when our federal CARES Act dollars expire. Giving workers the security they need to get tested and follow safety recommendations during this pandemic protects their health, their family's health, and the health of every one of us, the broader community, by decreasing the risk of spread. With this program, we are prioritizing the economic and physical health of our most vulnerable residents during the worst public health and economic crisis in living memory. I'm grateful to my council colleagues for their support of this work, and especially to our community partners who help us put people and families first as we continue to weather this storm together. I'd like now to invite one of those community partners who is enabling this work to happen to the podium, Columbus Urban League President and CEO Stephanie Hightower.
Thank you so much, Pro Tem Councilmember Elizabeth Brown. I just want to start out by saying that the reason why this program is so important is because you shouldn't go broke because you're sick. You shouldn't go broke because you're sick. Councilmember Brown has really outlined so much of what really needs to be said here. We all know, as she said, that Black and brown people are disproportionately impacted by COVID, that they are those frontline workers. They're the first responders that have been working throughout the pandemic. We know that African Americans and Latina folks are usually those low wage earners who do not have the same opportunities as many of us to work from home or work from your computer. And so this is just so smart. This is just the right thing to do. And I just can't thank you enough. I can't thank you enough, Pro Tem Councilmember Brown, for having the insight and the foresight to understand what working people are dealing with and to have this boost so that they are helping to protect all of us is so important at this really critical and unprecedented time in our nation and in our community. So on behalf of the workers at the Columbus Urban League, we've been those first economic responders. We are ready to go. We are ready to make sure that people don't go broke, that people can still pay their bills, so people can still make sure that their children have food on their tables, so we can make sure that they can keep a roof over their head, so that they can pay those doctor bills, and so that they can come back to work feeling good, feeling safe, and their coworkers also feel good that they have done what they should do to protect everyone in the community. So again, thank you so much to council for, again, leadership, because during this pandemic, we have really needed leadership in this country. And so it's now my honor to introduce Center Director Ramona Reyes from Catholic Social Services, who we look forward to partnering with on this important work.
Thank you, President Hightower and President Pro Tem Elizabeth Brown. The COVID virus has had a devastating impact on Hispanics in the Columbus community. Many Hispanics are afraid to test. They're afraid to test positive. They're afraid to lose their wages, lose their jobs, and be unable to support their families. Many of the Hispanics in our community are the restaurant workers. They are the ones who were laid off first, and they are the last to be rehired. Many are still looking for employment at this time. Many Hispanics are also the people who are subcontracted out. So in times of crisis, you have to go through multiple layers in order to get to the services that are required for them to get money and assistance to help pay for their rent, help pay for their bills, and help pay for the simple things, basic necessities such as food. We want to make sure that we thank President Pro Tem, the staff of the council and the council for this great opportunity to help the most vulnerable in our community. Our Hispanic workers, again, are the most vulnerable, and also in addition to our Black and brown community. So again, thank you very much for this opportunity to serve you through Catholic Social Services, Our Lady of Guadalupe Center. Now it's my pleasure to introduce the Ohio State University Wexner Medical Center, Dr. Daryl Gray.
Good afternoon and thank you. First of all, I want to thank you, City Council President Pro Tem Elizabeth Brown, really for taking the lead in championing an issue that is directly aligned with our mission, vision, and values here at The Ohio State University Wexner Medical Center. And I speak on behalf of our learners, our leadership, our physicians, our nurses, our researchers, our students, our staff, and our patients in thanking you for taking this important lead on this issue. And particularly, it's so important for so many of our essential workers, our critical infrastructure workers, in mitigating the health and financial implications of COVID-19. It's no mystery that COVID-19 has taken a magnifying glass to the structural, social, and health inequities that have been long-standing in this community, locally and nationally. Black and indigenous people of color are more likely to reside in congregate living environments in which it's more challenging to safely physically distance from one another. They're more likely to live in neighborhoods with environmental hazards that contribute to risk of chronic diseases. And they represent a greater proportion of essential workers, those critical infrastructure workers who have to interact with the public, do not have the luxury to work from home, and those who live paycheck to paycheck and thus have to think twice about getting tested even when they feel unwell, given fear of having to miss work and not earn money that is so critical for themselves and their family. Unfortunately, as has been documented by the CDC, these same people have been 2 to 4 times more likely to contract the disease, be hospitalized with the disease, and to die from the disease than our white residents in our very communities. And certainly this is an important issue, and it's a strong stand that we take now. We're amidst influenza season. And as we continue to try to push and build relationships such that people come in to our health system to receive the necessary flu vaccination, this is another step in building trust. We do not want to penalize our community members who get sick, get tested, seek treatment, and need to safely recover at home. We believe that our essential workers have a right to recover. This legislation says this loud and clear and puts our money where our mission is. The new Right to Recover program will provide 2 weeks of income replacement, up to $750 for those who qualify before December 31st. The new initiative will be implemented as has been stated by the Columbus Urban League and Catholic Social Services. So thank you all, and thank you, President Pro Tem Brown, for your championship of this issue.
Thank you. Thank you so much to these 3 speakers. And, I just want to underscore what I heard over and over again repeated by the 3 people behind me, which is the essential idea that if you have means, if you have steady income, you have choices. You tend to have choices. And what not a luxury, what a lifeline choices are right now in the middle of this global pandemic. If you are a low-wage earner, you do not have those same choices. That fundamentally is unfair, and it fundamentally gets in the way of our community-wide interests to recover and find our next normal in the city of Columbus. So thank you to these 3 speakers behind me who provide invaluable insight. I want to really thank Guadalupe Center and Columbus Urban League for the incredible partnership that we're embarking on to help ensure our most vulnerable residents can recover and don't have to sacrifice their family's well-being to do so. So with that, I can take questions here, or we can do individual. Individual? Great. All right. Thank you all so much for being here.